Dr. Jeremy Bettle was with us today. This is really an elaboration of what we've talked of a number of times before, anti-aging, using medicine 3.0. His experiences as having a PhD in human performance. He's been involved with professional sports teams and Olympic teams over the years, and now wants to transfer all of that experience to improving life for the average person so that they are happier, stronger, able to do the things they love for a longer period of their lives. Really thought-provoking, and again, a great idea through the Vitality Collective. Enjoy it. But what do I know? I'm just a vagina doctor. Okay, yeah. Dr. Jeremy Bettle, PhD in human performance.
Correct.
And you put that to good use. You've had some very interesting experience over the years with professional athletic teams, NHL, NBA, Major League Soccer.
Mm-hmm.
Been involved with the Olympics, you told me, in 2012. That must have been a trip.
Yeah, amazing.
And but now you're not doing that anymore. You've founded an organization called the Vitality Collective in Santa Barbara.
That's right.
And basically what you're doing with that is a philosophy of treating everybody as a professional athlete, so that they will feel better and have a healthier and probably extended lifespan.
That's right.
Karen and I are also involved with that. So we are clearly believers as well.
Right.
But I'd like to hear in your words, why? What's the logic? Why we don't all want to be professional competitive athletes?
Yeah, that's right.
But maybe we wanted to, but never could.
Yeah. It wasn't a lack of desire.
It wasn't a lack of desire, exactly.
Yeah.
So tell our listeners.
Yeah, so really it's stemming out of the systems that I built to take care of athletes. So what we looked at was, if you take an athlete, they've got to perform, say on a Saturday night. We're going to practice again on Sunday. We're going to play again on Monday, practice again. So every single day, they have to perform at an elite level. They have to be at their absolute best every single day. In doing so, what we were finding is that we were preventing injuries, which means the athlete didn't miss time. They could practice harder, so they got fitter and in better shape. And over the long run, we're actually extending their careers because they weren't getting these injuries. So the number one marker or predictor of injury in an athlete is previous injury. So the fewer you have, the less time you miss, the less injuries you have, longer your career is going to be.
So how do you avoid those injuries?
First of all, there's a ton of reports in the literature about what are the risk factors for injury. And so we did some extensive literature reviews. And if you look at the NHL, the big one is groin injuries. So we went into the literature. We looked at every factor that could impact a groin injury. And then we created a system of monitoring around those risk factors. It's very typical in sport to measure at the start of the year. So when athletes come into training camp, they'll get tested for their fitness and all the rest of it. And then you test them again next year when they come into camp. But a lot happens in the meantime. So we switched from screening to monitoring, meaning we tested them every 2 weeks.
Wow.
And it was basically an extensive N of 1 study. So for each athlete, what we were doing was building a longitudinal data set of their norm data around these risk factors. So every 2 weeks we measure, and if they deviate by one standard deviation on successive measurements, we create an intervention around that.
Okay.
And it's a multidisciplinary intervention. So if the strength of the adductors decreases, they've got an intervention with the physical therapist who's looking at neural outputs from the back. They might have an intervention with the strength coach to physically strengthen that muscle. They're working with a corrective exercise, people to help with the hips and pelvis. And so everybody from their perspective, all zeroing in on that changed metric. The athlete hasn't reported or felt any pain yet.
Right.
And that's the key point. We're not responding to the athlete coming in and saying, my adductor hurts. We're looking at these data points changing over time and creating proactive interventions to then ward off the injury. So the athlete doesn't know why he's on the physio's table.
Yeah. So, and tell me a little bit about that testing particularly.
Mm-hmm.
What are you doing that testing? I mean, you're doing things like a VO2 max and you're doing maybe full body composition DEXA. But how are you looking at somebody's muscles or ligaments or joints? All of these things that can be a problem.
Yeah. So again, it comes back to a multidisciplinary approach. So we go all the way down to the joint level with our physical therapists, and they're going joint by joint through the body, and they're looking to determine what are the areas that we can impact through exercise, or what areas do we need to impact through physical therapy. So there'll be certain limiting factors. Like we found athletes that came through going into the draft who had maybe they'd had a series of ankle injuries, which led to them to have fused joints within the ankle. Well, that's not something we can impact.
Okay.
So that's an athlete that we would probably not draft. If that was someone in our group, we're now looking at, okay, how do we impact the surrounding tissues? So the PT is sort of determining at what level do we need to intervene at the joint. We then zoom out and we start looking at the muscle testing. So various pieces of apparatus from companies like Vald and Kangatech, where we're looking at the isometric muscle strength either side of a joint. For example, the glute and the adductor for hip strength, quad and hamstring for knee strength. And we go and we start measuring joint by joint each one of these important areas for us. So we're looking at ratios between opposing muscle groups. We're looking at absolute strength thresholds. And then we're looking at ratios side to side, looking at symmetry.
Are you doing this with exercises? Like you're having the athlete do something and then how are you actually monitoring?
Yeah, so that's the next, so these are strength tests.
Okay.
So they'll be pushing against the machine that we're using to measure it. So they're pushing, for a groin squeeze and then a pull for the glute so we can get either side of the hip. So it's a maximal effort test where they'll try and hold an isometric, which means a static contraction for 5 seconds, and we'll do sort of 3 and take the best one.
Okay.
Yep. And so it's a strength measurement.
And how long does this testing take? Like if you're doing it every 2 weeks, is the athlete with you for how long?
So we can get through it pretty quick.
Okay.
We had it down. And now in sport, we've got this, extensive team and we see the players every day. So we'd probably on a screening day be through the full screening within 20 minutes.
Oh, wow.
Yeah. So we can get through pretty quick. So that's one part of it. And then we actually we go from individual muscle testing and now also how do we move? So the combination of the joints and the muscles, we're looking at the interaction of those two for our neuromuscular evaluation. Maybe the joints limiting movement patterns and creating dysfunctional movement. Maybe it's weak muscles or imbalanced muscles. And so looking at that as a holistic view, and then going a step further and now looking at those muscle qualities. So for example, we might do a vertical jump and we might see that they're very slow lowering into the jump, but quite explosive coming out. So we start looking at which characteristics of those muscles might be changing throughout the competitive season.
Wow. And so now fast forward to what you're doing now with just Vitality Collective, and we're looking at just the average, not an athlete, but somebody that wants to stay, young and vital and age well.
Well, let's go ahead. Sorry.
Well, yeah.
Finish.
So, okay.
So I think maybe there's a link here, the logic in going through this, because it's well established that that physical strength, muscle mass, VO2 max, good levels of VO2 max, are all associated with greater chances of longevity and a health span.
Yes.
So that's the logic. That's the reason for taking your technology, your knowledge, your experience into this other area.
Yeah.
Am I accurate in saying that?
Absolutely right. And if you look at expanding on, that was just sort of the physical musculoskeletal components of what we were doing. We had an extensive team where that sort of cycle of intervention, assessment, intervention, and performance, and that continuous cycle was going on with our doctors, with regular, maybe every 6 weeks even for certain blood markers. Every facet was providing data. And so in coming out into the real world and starting to work and look at how the healthcare system was taking care of people,
we're not.
What I realized is that we were doing medicine 3.0.
Yeah.
Yeah.
Right. And so we just, for us, it's high performance medicine. Right. So this was our high performance department.
Right.
And so you come out into the real world and think, well, look how well we treated these athletes, and all of the structures to do that outside are in place. Yeah. But there isn't really a paradigm for it. Now, I think we're really at the front edge of a wave that's now with increased awareness, with Peter Attia's book coming out, and he really outlined it beautifully, how all of these factors are linked back to your longevity.
Right.
But you're absolutely right. My opinion on this is that I don't think we're going to medicate our way to longevity. And I don't think we're going to, any one of us has the answer that's going to take us to longevity. But as a collective, if we're all acting together in these complementary fashions, so frailty being, I think, the number one killer, because it's going to lead you to all of these other conditions where we're going to need medicine to now react to a problem. If we can keep you active, if we can keep you strong, if we can keep your muscle mass high, we can keep your bone mineral density high, then I think we're going to avoid these instances where we actually see a big drop off in our capacity. And these are the factors that are going to create a more sedentary lifestyle, a more isolated lifestyle, which is a huge risk factor.
Yeah.
And these are the things that might not be a problem right away, but over time, that's not a good trend. We can't have these sort of stepwise decreases in strength, in VO2 max, and expect to take a lot of health into our later years.
So where do you start with a patient? Who should they be seeing first to move in this direction? Or is it up to the physicians to tell patients that they should be doing this, or both?
I think it's at all of our responsibility.
Yeah.
Wherever they come into the system, it's on that practitioner to extend and expand the level of screening that they do.
Okay.
That people are going to come to this in very different ways. You're going to have your longevity enthusiasts who are in great shape. They're already doing a lot of great stuff, but they want to go deeper and deeper and deeper. And they're going to come and they're going to be really excited about it. We're going to get people come in who have had an injury or a surgery. And so they're going to come more in through the physical route. And we're going to start expanding upon and going around their rehabilitation, but in an expanded fashion. And then we're going to have people who come in through the medical route. Maybe they've already been diagnosed with a condition, or they come to you and might start talking about optimization versus sort of, I don't want to wait till I'm sick, to get treatment.
Yeah, right off the bat, I think of, Duncan, our patients that have the problem with their bone density.
Yeah.
Mm-hmm.
And they're really worried. I mean, and they don't know what to do.
Yeah.
And we give them supplements and then we retest them. But, they would be, I think, the perfect group to...
I think you're absolutely right. And it's a point that I want to make when I was thinking about talking to you today. Peter Attia has described what he calls the four horsemen, the major causes of ill health.
Right.
And he talks about cancer, diabetes, neurodegenerative disease, and cardiovascular disease.
Right.
I would add osteoporosis to that because I
Right.
think it's separate.
Right.
I think it's just as important. And in
Yes.
fact, North American Menopause Society have really focused on osteoporosis as being a major issue now that is just not being adequately assessed and treated. And a lot of people just think, oh, I've had a bone density study and I've got the first stages of osteoporosis. I'm getting osteopenia, but I don't want to take any of those meds.
Right.
And it's like the cure is worse than the disease for a lot of people. A few months ago, we had people from the Bone Score organization. This was a test that was developed at UCSB to look at bones in a different way. The bone system is a completely active, moving part all the time in our health, and all we've had to look at is bone density, which isn't great, and also moves rather slowly. And with Bone Score, we have this device, this ability to test the hardness of the bone, which is showing to have a greater, be a stronger indication of weakness of bones or risk of fracture. And of course, it's not paid for by insurance, and it's not done by very many people. It just happens that in Santa Barbara, we've got at least 3 practices that do this, including ours. It's a very simple, safe test, and it's really so that has just pushed my interest towards osteoporosis. And I mean, it's an example of the old adage: if you don't use it, you lose it. Whatever it is seems to be the case.
Right.
And so I see people who are riding horses, and I think, and they got brittle bones. Come on, just this doesn't make sense.
Right.
But
and younger lately in the office, younger
Interesting.
patients with the bone, with the osteopenia.
Right.
So
that's another part that if I could add to Peter Attia's excellent publication, it would be, let's deal with osteoporosis as well, because I really think it's one that's there, and we've now got better ways of looking at it.
Yeah.
So I haven't really determined the best treatment for this, and that's not my specialty. As I say, I'm just a vagina doctor. But I know where to send patients to rheumatologists for that.
Yes.
So I love this idea of the collective because it's multi-specialty and it's physicians and practitioners of providers of like mind, just really focusing on how well can we keep this patient?
Yes.
And which brings me to another question. How would you describe the difference between vitality and longevity?
Yeah. And that why I went with the name Vitality Collective was to make this distinction.
Right.
When you look at longevity, or when you talk about longevity, especially with people that we sort of want to start having this conversation with, people in their 40s, when you're in your 40s, longevity seems like a concept that's way out in the future, right? I'll deal with that at some point. That's sort of how athletes were dealt with. It was wait until they've got an injury, wait until they come in and report being sore or in pain, or wait until the injury happens.
Or wait until you have chest pain.
Exactly right. Yeah. Name the condition, right? We don't have to stick with athletes. That time lapse of life that happens in sport, like we talked about, play Saturday, train Sunday, play Monday, it means you've got to be vital every day. It means you've got to do every single thing, leave no stone unturned to be able to perform at your optimum every day. So take that into this longevity space. We want people to do the activities they love, to remain physically active for as long as is absolutely possible for us. So that's the health span piece.
Yeah.
That's vitality. If these people who've got brittle bones and they're riding the horse, if we got to tell them, well, you got to stop riding your horse. That was their activity. That's the thing that brought them joy.
Yeah.
So now we take that away. Well, now what?
Yeah.
Right.
It doesn't matter if
Right.
they're living longer, if they can't enjoy
They
their
can't
life.
enjoy that.
Right.
Yeah.
Exactly.
Right. And so if we can get them before we have to make that call, and we can identify these things early, and we can have this multidisciplinary intervention, now people are living with vitality, with purpose. They're around their community. They've got all these support structures in place. We're going far, far downstream from the 4 horsemen, the 5 horsemen now. We're going way downstream, because now if I stop these activities that I love doing and I'm removed from my community, now we're on a path to one of these diagnoses.
Yeah.
So that's vitality. It's thinking about every day, how do you feel? Not waiting for something to become painful or too painful. You know, I've got a sore knee. Okay,
Yeah.
well, I'll wait and I'll wait and I'll wait until I can't walk, and then I'll go and see a physical therapist.
I think that though that's kind of human nature. People do wait and they procrastinate on their health.
Yeah.
I personally do that, and I'm in the industry. So how as far as the messaging goes and getting people on board, how do you see that?
Yeah, I think part of it is how we've sort of been conditioned as well. You know,
True.
with our insurance, we get so many checkups, right? When you're in this sort of current model, a lot of it is environmental, where you only get a certain number of checkups,
Right.
or a certain number of treatments. And so I think that we're sort of conditioned to be good enough, and we're moving away from that.
Yeah, I mean, you're absolutely right that most of the time, an individual looking at their health, or the physicians looking at their health with them, is really telling them basically whether they're normal.
Right.
Okay, well, normal is not good enough for
Yeah.
most people.
Right.
Okay, and it's more like, trying to think, Tom, clothing designer.
Ford?
Yes. Okay. He was asked in an interview sometime, you know, how do you look so good? He said, well, I stopped smoking and I stopped drinking alcohol. And he said, but I'm not trying to look younger. I'm trying to be best in class.
Right.
And I love that expression, because that's what we should be going for.
Yes.
You know, so when you ran my VO2 max and you could tell me I was in a pretty decent percentile,
Right.
I felt good about that.
Exactly.
You know, it's just, yeah, I'm maybe not best in class, but I'm pushing it.
Yeah.
Okay.
Towards the top.
Towards the top.
Yeah. Excellent.
And I think that's something that, you know, we were talking, Karen and I were talking about the upkeep that people have to pay or do to stay in the same place or to improve, whether it's skin or bones or health or any function. And upkeep is necessary.
Yes.
Or the alternative is just not acceptable. You know, just let it all fall apart.
Yeah.
So I think that making that case to patients is crucial.
Right.
And that's why when we were talking earlier about how do people get in there and how do they start with this whole idea of getting into into that mindset or with the right people.
Right.
I mean, in Santa Barbara, although the Vitality Collective is young, it's only just happened. It's been in your brain for a long time.
Correct.
It didn't take long for us to get involved with it, and others are involved as well. Pretty much anybody who's sort of sensible and loves medicine and loves vitality and
Yes.
And health span agrees that this is the right thing to do.
Correct.
And we've got a collection of people now who are like-minded. We don't have enough people,
Right.
enough physician providers that are thinking that, because most people are in this medicine 2.0
That's correct.
situation.
Yep.
So I think this is this arena, this opportunity on the podcast is directed appropriately.
Yeah. Well, and there's a couple of things, like as we move into sort of medicine 3.0 or high performance medicine, it's no longer good enough for us to just sort of report the data. Like, we are now coaches.
Yeah.
So that's the other side of answering your question there, Karen,
Yeah.
is we must move from being practitioners to coaches. So how do we create a plan where our clients just have to show up? Because, you know, this is a very, very complex system that we're dealing with. We have to be able to coach our people through it, where it's actionable in their life and it's based around their goals. So I see us as having various sets of goals. Ultimately, we're working towards the patient's goal. They want to ride horses. Our goals for them then become, how do we get them to safely be able to do that?
Yeah.
So if it's bone mineral density, how are we all surrounding them to improve their bone mineral density through physical therapy, through medicine, through fitness training?
Right.
All of these different factors need to come in to get them to their goal so they live their best life. Because how often do we hear, oh, your shoulder hurts, stop playing tennis?
Yeah.
Well,
right.
That can't be right.
Right.
Yeah. And I feel like with a collective like this, it's going to be so much easier working together, because oftentimes we have patients that, I went to my PCP and they did these tests, and then I went over here and did that, and then there's that really, I think, place where we're not connecting the dots well enough
Correct.
to be able to really treat that patient.
Right.
And we don't have enough communication with that other physician to really know,
Yeah.
have the conversation about the patient and really what's best for them.
Yeah.
And that's what I really like about this, because for me, I always want to do the most we possibly can. I take it really seriously when a 46-year-old has osteopenia.
Right.
She hasn't even gone through menopause yet.
Right.
She's healthy. She's young. She's a mom. What needs to happen here? Who are we handing her off to? Where's she going?
Right.
Where did she go?
Yeah, exactly.
So this to me is just, I love the idea of the collective and a group of us, and to the people that are involved now and going to be involved as you move ahead with this, all working as one.
Correct. Yeah.
So
with the patient at the center.
Yes, the patients at the center.
Right, the patients at the center, not us. And so we are all organizing around their goals, around their optimal. Like, what is optimum for them? That 46-year-old might come and say, okay, I want to hike Everest. Okay.
Yeah.
Then it's our job to get them in the best physical condition they can be in to do that. We understand what the demand is going to be. And so now we can train them to that.
Yeah.
Bones need to be right. Blood needs to be right. Physical fitness needs to be right. Cardiorespiratory function needs to be right.
Yeah, because I think there's too much acceptance when people aren't feeling right.
Exactly right.
Well, I'm getting older. Right?
Right. But this is exactly, we go back to sport. Athletes get injured. It's a part of sport. Well, why is it? Like, we know what the demands are. We know they're going to have to sprint down the field. Why are they tearing their hamstring?
Yeah.
Yeah.
But
Yeah.
and something that you and I were discussing previously was, I think it was in the hockey arena, that you went 2 years with like no injuries, something absolutely almost unbelievable.
Yeah, we did 3.5 years with 0 non-contact injuries.
Okay.
And this was something where, again, it's a very traditional sport, groin injuries. You would expect 4 or 5 in training camp when guys just come back from the season. But if you put these deliberate interventions around and we prepare them for the demands that they're going to face, same with our patients. If you want to ride your horse, here are the demands.
Right. Yep.
Right. We know the demands. We know what we're preparing them for. And so we can do that. We can build them up. But it takes all of us.
Yeah.
Right. I can't impact bone mineral density or bone score as much alone as I can with you.
Right.
That's the point. And to just backtrack on your previous point about we don't have enough people doing this yet, what we're doing is we're modeling for people how they can do. Because look at the impact that Outlive had on physicians' mindsets in general.
Yeah. Right.
Think about how many people now know the term Medicine 3.0 because Peter put the book out.
Right.
So now we're starting to see a shift. What we're going to do is model a system for them to do that. We can show them how. We can show them the systems. The communication, it's not as intuitive and easy as you think. Even in sport, it wasn't.
Yeah.
It's a system that needs constant maintenance because we're all busy.
And
we all drift. It's that entropy, or we all start drifting apart, and we've got to actively come back together. We've got to have systems in place to make sure that the communication stays centralized.
Yeah.
And that, in sport, it was a case of information was currency. It's very clear power dynamics in sport. And if you were a hub of important information where the coach and the GM needed you, it's like you were powerful, you were secure. So one of the major things we had to do was break down those power structures and democratize information. And, we'll do that within obvious, HIPAA guidelines and all the rest of it. But if we all know what we're working on, and we have regular check-ins, then we can't not succeed in this.
Just quickly, give an idea of the frequency of evaluation for somebody who just wants to stay active, he or she's playing some sport, and they want to keep doing it, whether that sport is just walking or hiking. Just what would be a reasonable frequency of being checked and being assessed and being treated, and how long do you need to go before you check again? That type of thing.
So we're looking at basic physiological adaptation. So there's going to be different cadences based on how quick things move. We don't need to do a DEXA scan and get a bone score every week, right? It's just not going to change. So things that are going to adapt pretty quickly, your muscle strength, we're going to measure every 6 to 8 weeks.
Okay.
That'll allow your program, so to be, number one, when we measure that, it'll be hyper individualized, right? We're really on that first spin of the circle. We're looking at asymmetries. We're looking at imbalances, side to side, antagonist muscle groups. That will allow those changes to take place. We measure again in 6 weeks because then we're going to start plateauing. Your gains are going to stop. So your program's going to grow with you from a performance standpoint.
Okay. So
things like VO2 max, we can space those out a bit, and maybe they go quarterly.
Yeah, because they're miserable.
Yeah, exactly.
I need to do one.
Yes, you do. It would be my pleasure.
Okay.
As we talk about how miserable.
I want to watch.
No.
We charge extra for that. Yeah. So we're going to space these things out, whether it's every 6 weeks, your physical. And again, it depends what depth you want to go into.
Yeah.
So if we look at the whole thing, where, every 6 weeks, muscle strength, every quarter-ish, we're going to be looking at cardiorespiratory fitness. We're going to be looking at, maybe there's some blood markers we want to check in on. Maybe we're looking at DEXA for body composition. That's the other side of DEXA that I think is, people very much focus on the bone density scores.
Right.
Being able to look at body fat and what's visceral fat, which is way more dangerous for our longevity.
Yeah.
So those are changes that we want to see a little bit more regularly, sort of quarterly.
Yeah.
We'll zoom out and there'll be some sort of biannual check-ins. Maybe it's a broader blood panel. And then annually, you're looking at maybe it's your whole body MRI, some really advanced muscle testing that sort of goes along hand in hand with the MRI. And we can look at fat infiltration in the muscle and all these things. Things like, whether it's the Gallery, blood tests and things like that. Maybe those are annual sort of tests. These are things we don't need to be doing, like I said, weekly.
Right.
So again, depending on how deep you want to go into your longevity, and how, people are these enthusiasts who are getting really into it, are starting to go really, really deep like that. That would sort of be the cadence.
Great. Well, thank you. I have
I have just one thing to say about our community, Santa Barbara. I think is the perfect place, the perfect sized place for Vitality Collective.
Right.
And most people here are, activity is a big part of their day.
Exactly.
And so wanting to maintain that and keep that going. Also, I think they're more, people here are they're more accepting of working outside of their, insurance or what their medical, what it looked like. They're more open. I know people that come to our office when we say, well, it's cash pay. Yeah, I know, it's fine. You're not, arguing about it. So that they're just more, I think, accepting of, I think the way it's moving, especially with the collective, is the way it should be. But we're in that little in between. Yeah. Right? Where there's so much ground in front of us too.
Yeah, there's a lot to do. And particularly from an education standpoint, as we've talked about. But look at Santa Barbara as well. And one of the reasons that I certainly wanted to be here is because it's a playground. The mountains, the ocean, road biking, all these different things you can do here year round. I see us as the high performance department for Santa Barbara.
Yeah.
We are here to prepare people to enjoy Santa Barbara.
Right.
So that you can continue. We live here for this environment. If I couldn't go hiking, like, what am I doing here?
Well, you'd probably be playing with your cats.
I almost certainly would.
Okay.
Yeah. That's my primary activity that I'm training for.
That's right.
Yeah. Pumpkin is well taken care of.
Okay.
Yeah.
And the other thing that that you said that you were really obsessed about was gardening.
Oh, yes.
That's
another activity that people can't do as they get older.
Exactly.
They're like, they come back in from the garden and they're just worked over.
Well, that's very English of you too, to be.
Yeah, I inherited it from my mom.
Okay.
Yeah, but think about like gardening and how good that is for longevity. And think about these blue zones like over in Japan. Yeah. You're up and down off the ground. You're lifting. You're moving in non sort of linear movement patterns.
Yeah.
So these are things that are critical. But there's also a mental health element to gardening. There's some recent studies that have been done around the wonder and the awe that you have for nature, and just looking at these plants
that grow,
that are just miraculous.
Yeah.
Right. And you just look at these things and how they grow and how they're shaped by the weather. And so there's a longevity component there to experiencing wonder and awe.
And the other thing that you were in awe about recently was how well you bake bread.
Oh, yeah. It was a recent sort of diversion back to baking bread.
Yeah.
Yeah. So, but it turned out incredibly well.
Is it sourdough
It
bread?
is not. That's next. That's
Okay.
next. Yeah, my mum had me standing on a stool from the age of 4 baking bread with her. But then since I've been in the States, I haven't really baked bread. But
Okay, I'm
got right back
expecting
into
bread delivered to the office.
it.
At
You
some
will
point,
have a loaf.
'cause I love bread.
Amazing. High quality flour, 4 ingredients. It's spectacular.
Great. Jeremy, thank you. It's been great
Thank you so
having
much.
you on.
No, it's been an honor being on. Thank you.
Thanks. Well, thanks for listening. We're getting really good feedback. We'd really appreciate a review on Apple Podcast, Spotify, or wherever you're listening. Thank you. You can always DM the Vagina Doctor Instagram with any questions or topics you'd like to learn more about, or email us. The Vagina Doctor Podcast. It all starts here.